First, why did you choose MBBS as your main career? And after that, why surgery?
Can you believe physics teacher was not there in class 12?
Neurosurgery is considered very toxic. Is that true?
It depends on the institute.
Top 5 institutes for surgery in India.
Most of the institutes are from. If you see my opinion,
Sir, how should a new first-year surgery resident handle the toxicity?
work properly, efficiently after 4 hours of sleep,
So, do you believe that the residents should be having strict work timings like corporates?
there should be.
So, what made you switch from a surgeon to a faculty?
They forced me to resign from the institute.
While you were teaching surgery, how the curriculum and the content is changed?
So I'm telling you, all the faculties, the spoon feeding is the best way of teaching.
What would be your advice for a NEET PG 2025 aspirant?
These are the 7 rank deciding subjects. Are must.
Sir, how much does a surgeon earn in India?
Yeah, it's an easy thing.
Joseph Kennedy has said, when the times get tough, the tough gets going. I think this line fits the best when a surgeon comes into the play. Our today's guest is a very special person. He is a friend, he is a motivator, he is a faculty, and he is an amazing surgeon. We are talking about the legend himself, Dr. Pritesh. I think you all know everything about Dr. Pritesh's day to be. But in today's podcast, we are going to talk about his journey from where he started, where he has reached, how he has become an amazing person, and what his dreams are yet to be fulfilled. We talk about surgery as a branch in detail. What kind of super specialties are there? How to rate them 1 out of 10? What specialties will be the best in the upcoming future? And will AI be a good replacement of surgeon in the upcoming years? Dr. Pritesh himself is a graduate from Maulana Azad Medical College, postgraduate from Lady Hardinge, and has been an educator in the NEET PG segment for last 15 years. He's an author, he's a motivator, he's an investor, and he's a faculty. So many words to describe a single person. So let's put our hands together and with a huge round of applause, let's invite Dr. Pritesh to our podcast. So boss, let's start with your journey. So you are a graduate from MAMC, a postgraduate from LHMC.
Yes.
Both the best institutes of our country. So my first question would be that first, why did you choose MBBS as your main career, and after that, why surgery? I think why surgery would be one of the most sought after questions since NEET PG counselling is going on.
Right.
Students are wondering whether they should take surgery or not, and there are so many assumptions, rumors around surgery, the hard, long hours, the hectic lifestyle.
Right.
So my first question to you is, sir, why MBBS?
Okay. Actually, I come from a very humble background. So my father was a farmer, so I'm from a small village. And then I started my schooling from class 6 to class 12th. I was in Navodaya, Mirzapur district. You must be knowing the web series. So nowadays everybody knows.
भैया थे वहाँ पे.
At that point of time, these things were there, but now it's not there.
All right.
So it's a long story. When I was in class 11th, actually I was having both bio as well as maths. So initially I was preparing for engineering. So one of my cousin who cleared MBBS, he told me that it's very difficult to clear IIT and you can't clear. So I was having self-doubt that if somebody who is already doing MBBS telling me that you can't clear IIT, so I think I can't do. So after that I switched. I was having biomaths both. So in 12th I started preparing for MBBS. Second story, that in 12th class we were not having physics teacher. Can you believe physics teacher was not there in class 12th? So 3-4 students of our batch, they decided that we would study ourselves and then we will start teaching our own batchmates. So we started teaching our own batchmates, and you can't believe after results, in science only one subject was having 100% result, and that was physics. And I got the highest, 97. So that was the journey, and after that I was so much into studies because I used to like physics subject and I was preparing for MBBS. So after 1 year of preparation, I cracked, at that point of time it was All India PMT exam, CBSE PMT. So I cracked that and I got 22nd rank. So then I joined MAMC.
Perfect.
And since I was from a middle class family and from small village, so most of my friends were son of doctors, having a big car, good lifestyle. So I was having that thing that obviously I have to study, but simultaneously I have to earn money also, right? Because I also want that kind of life. when I joined Lady Hardinge, because I heard that surgeons are very famous and they earn a lot in comparison to the branches in which you are not doing intervention. So initially my focus was only money. I'm telling you fact. Yes, because my friends were quite rich. I was not up to that level. So it was only money at that point of time. But when I joined Lady Hardinge, then I started, liking this subject. And my principle was I was not having any expectation from anybody. I was in the hostel since class 6. So I used to stay alone in the hostel, obviously. So when I joined during my residency, my goal was that if I'm going there, if my senior will allow, then I'll take some rest. Otherwise, I'll stay in the ward only. So I used to stay in the ward only. And there was only one PG, one first year PG in the whole unit. And that was me. And there is only one second year PG. So in the whole unit, only 2 PGs. So you can imagine that almost on daily basis, you have 24 hours. So I was having a small bag with all my clothes, toothbrush, paste, everything. So I used to take bath in the ward itself. There is DDR. I used to sleep there only. But my alignment was that I have to work hard and I have to achieve that level. Meanwhile, when I was doing residency, I saw one notice that if you are interested in teaching, please contact us. So I contacted that fellow. Then he said that, okay, we want a demo class of yours. And I gave the demo, they liked. So initially they were paying 750 rupees per hour. And there was one manager in that institute. He joined some other institute. Till that, after that point of time, I completed my post-graduation. So I was doing senior residency. So he contacted me again that you come to this institute and then payment increased almost, 4-5 times. So this is how, things moved in this direction. So in surgery, because I was not afraid of doing hard work, because I was from rural background and I saw the hard work of people, staying in the village. So for me, that was not a factor. For me, financial reward, fame, these were 2 factors. That's why I chose surgery. And apart from, doing residency, I started teaching only for my side income, so that I should be getting something extra. So this was the, journey. And when I was doing post-graduation, I was interested in teaching. So student used to come in the ward, especially to have case discussion with me. At that point of time, I think I was in second year PG. So they were not attending the classes of senior residents, they were attending my classes. And in OPDs also, they were coming to me. So because of this, some of the senior residents were offended. Even consultants were offended. So what they told students that if you are going to that room in which these postgraduates are sitting, you won't be able to pass the exam. So after that, the students started going to senior residents room and consultants room. So I thought that, okay. So I told the students that, okay, you can come in the evening. If I'm doing some kind of round work or ward work, at that point of time, some special case will be there, then I will teach you. So this is how, I came into this field, and this was the journey.
Amazing journey, boss. Amazing journey. And it's very inspiring. I think you have just bought a new E-Class also, a Mercedes. So congratulations for that. I'm sure your parents must be very proud that, the dreams that you had in your own childhood, your youth, you have now actually made everything a reality. You are a famous, I think, a globally recognized faculty, surgeon and whatnot.
Thank you.
So, Dr. Pritesh, I think the question here is, which I'm going to repeat, is that when in your own time you were going to choose, when you gave your postgraduate exam, you must, I'm sure that you had a great rank, so you must be having multiple options in front of you.
Yes.
You chose surgery. At that point, in 2000, I think 12 or 13?
2008.
Okay. So in 2008, what were the pros and cons of surgery?
Yes. The pros and cons, because those pros and cons are still there. But at that point of time, hard work is there. Because you must be having a mentor or senior who is going to teach you.
Okay.
The surgery, the surgical skills, you cannot acquire yourself. In medicine, the good thing is that you read Harrison, you see patients, and some seniors, if you do the case discussion, attending the wards, you can learn the things. But here, you need a senior. So actually, you have to give respect to your senior, and you have to do some extra work so that your senior is happy with you. Simultaneously, you should not show your talent to your senior. So stay hungry, stay foolish. Means you should be acting just like a fool in front of your senior. So it was very common when we were, in the ward on rounds, and suppose consultant or professor was asking some question to my senior, and if he was not knowing the answer and I was knowing the answer, I used to not reply. So that his ego should not be affected, right? So you have to give respect in return. And second thing, you have to work hard. You have to do some extra work of your senior also, so that if he is happy, he will teach you the skill. So here learning curve is longer. And for settlement, at least after post-graduation, you need at least 3 to 6 years, because 3 years of super specialty and 3 years of experience. But in medicine or in some other branches, even if it's a terminal branch like ortho, like pediatrics, so just after post-graduation and senior residency, you can be settled. So this is the pros and cons here. If you're working hard, because financial reward is too much, if you're doing the intervention. So this is the main pros. And the cons, learning curve is longer. So it's my opinion that if a road is rough, so rough roads leads to, ultimate heights of success. So it's up to you. You want a rough road or you want a smooth road, it's up to you.
Sir, is super speciality a must for surgeons in upcoming times?
No, it depends on the branch. Suppose you are doing MS surgery and after that you want to go to the minimal access surgery. So in minimal access surgery, without super specialty, you can go for lots of fellowships. So there are fellowships of minimal access surgery, laparoscopic, bariatric surgery, and people are doing amazing work, because most of the cases you will get in the market: gallstone, hernia, hydrocele, perforation, appendicitis. These are the common cases, and obviously everybody wants that the surgery should be laparoscopic. So for this, you can go for super specialty also, but if you are not going to crack the exam, you can go for fellowships from multiple institutes, and after that you can start practicing it. But obviously in certain departments it's a must: neurosurgery, cardiothoracic surgery, pediatric surgery, urology, because for these branches people are looking for a super specialist. So minimal access surgery, laparoscopic, bariatric surgery, even in liver transplant also fellowship is there. And lots of Indian institutes are offering. Not only Indian institutes, foreign institutes are offering. So you can have fellowship from multiple institutes and then you can start on your own.
True. How would you rate out of all the super specialties, from, like, if you have to rate from the top,
Right.
how would you rate all the super specialties?
At present, on top is surgical oncology and urology. Surgical oncology, urology. After that,
You will put both them on one.
almost
Okay.
equivalent.
And if you have to, choose between
Choose
surgical
one.
oncology.
My personal favorite is surgical oncology.
Okay.
Why? Because number of cases of malignancies are increasing exponentially. So second is urology, third is GI surgery. Because what is the problem with GI surgery? See, I was actually preparing for GI surgery. So when I was preparing for GI surgery, I was not knowing the cons. But what is the big problem? In GI surgery, you are not going to acquire some extra skill. You are doing the general surgery operations only. And general surgeons are not referring those cases to you. So then you have another thing which is left to you, that is transplant, liver transplant. So that is the edge of GI surgery. Otherwise, it's not that good branch. Then cardiothoracic, neurosurgery, almost equivalent, and then comes the pediatric surgery, and in between pediatric surgery and cardiothoracic surgery there is plastic surgery. So these are branches. Nowadays actually lots of students are not going for cardiothoracic surgery and second neurosurgery, because the curve is very long. Recognition requires minimum 10-15 years, and somebody who wants to go for CABG, bypass grafting, so obviously he will go for the best. So that's the problem.
There is a rumor, I would say, that neurosurgery is considered very toxic. Is that true?
It depends on the institute. So you have to, read the history. Some of the consultants, see, it's the mindset. Suppose I'm from such a background that I want to spend my 14-15 hours into just the work, but I don't have a personal life. Suppose I'm a single person, unmarried, I'm a professor or I'm a HOD. So what should be my thought? That all my, postgraduates should be unmarried. So it varies from person to person, institute to institute. So you have to look that who are the people there and seek what kind of history that institute was having. These kind of, 3-4 institutes were there where there is very toxic environment. So I advise, see, your mental and physical well-being is most important. Everything is secondary. We came to this world to enjoy life also, right? Not only to do hard work and not, to do something. So your parents are waiting, your family members are waiting. So don't join any toxic environment just for, some kind of professional degree. Yes, it's better to join an institute which is of lesser reputation but better environment, not to join a toxic environment institute.
Great, sir. Sir, if you have to rate our country's institute in respect to the surgery department, So how would you rate, especially for the NEET PG counseling students, for example, the top 5 institutes for surgery in India?
See, most of the institutes are from Delhi. If you see my opinion, first would be obviously MAMC, Maulana Azad Medical College. Everything is balanced there. Though department is not that good, but it's good. The new people are actually good in Maulana Azad Medical College. After that, RML Hospital is there. Third Safdarjung Hospital is there. AIIMS is there. Lady Hardinge is there. So I would suggest that you go for Delhi institutes. Why? Because here the quality is good, quality of life is good, payment is good, patient load, work-life balance is also good, and number of PG seats are good. Suppose in one unit 5 postgraduates are there. So obviously the work is divided. And if you're going to join any institute where only 1 or 2 PGs are there, so obviously there is too much of burden. So if you see 1, 2, 3, 4, 5, it's my opinion. MAMC, then AIIMS, then Safdarjung, Lady Hardinge, RML Hospital. So my opinion, go for Delhi institutes. Second thing, bond is not there. 1 year bond, I think it will be applicable from next year onwards. And obviously, bond means you are working in Delhi or in Delhi NCR. So that quality of life will be maintained. And second thing, you are having lots of opportunities. Because I see whenever I go to the hospital, for some of my relatives, for my family members, I see my seniors and juniors everywhere working there. In each and every hospital, Medanta, Fortis, Max, everywhere. So lots of opportunities are here in Delhi.
Sir, how should a new first-year surgery resident handle the toxicity, handle the work pressure, and maintain a balance in their head?
Right. See, it's about expectation. Suppose I'm expecting this thing, that is 9 to 5 job. I should go at 9 and I'm free at 5. That person will be having, most toxicity because it's his expectation. And suppose you are having this kind of expectation that I'm supposed to go at 7 and it's my senior wish whether he is going to allow me or he is not going to allow me. So it might be a 24 hours duty. So if you are having this kind, it's just the mind game. If you are, suppose you are going to attend emergency 24 hours, right? There is no toxicity. But if you're going for the ward and you're not free at 7 or 8 in the evening, then there is toxicity. So accept this, that yes, it's 1 year of rigorous training. And let me tell you everybody that residency is not academic excellence. It's the testing of your physical strength. So whether you can work properly, efficiently after 4 hours of sleep, after missing 1 meal or not. So that's why have a bag, have something, keep on eating. Anywhere you take some time, relax there. But it's your expectation. Don't expect too much in first year. It's a rigorous training program. If you imagine that it's a rigorous training program, almost every alternate day you have to do 24 hours. If you accept this, you will be more than happy.
So do you believe that the residents should be having strict work timings like corporates? I think MAMC is the first hospital which has tried to implement this.
Actually, it should be. There should be. But what is the big problem? See, if you see the government institutes, if you become more senior, your workload is very, very less, right? And in private, it's just opposite, right? Why? Because there is fixed salary. So why people will do the work? They, pass on the work to the juniors. So that's why people are suffering. But the problem is where, suppose I'm first year PG, I'm, going through all these things. When I become second year, I'm doing the same thing. So if you want to change the system, actually you have to do the change. If you are a senior resident and you are punishing your interns, punishing your postgraduates, not allowing them on time for their lunch, obviously that person will not work. You can't believe, when I was first year PG, I was doing residency from Lady Hardinge. I used to, free my interns at 12:30. Go and take half an hour extra for your lunch. I will do that work. If I'm sitting in the ward, 3-4 cannula, if I'm going to put, and somebody, and there was fight that I want to go to this particular unit. And without saying, suppose you're going to free your intern at 12:30, go and take half an hour rest also. He will come happily within 1 hour. That, sir, no, I took rest. Tell me something to do. So it's just your behavior with other person. So there should be this kind of balance, but I want to, request all the seniors that if you want to change the system, first change yourself.
So if there's one thing you could change about the whole medical curriculum, education system, what that thing would be?
It would be the feedback of seniors. How they teach in the medical institute, there should be rating from the students. Yes, their behavior rating should be from their postgraduate, how they behave with the juniors. This kind of feedback system should be there. And promotion should be strictly based on this. Not only on this, there should be one exam also for the seniors who are there holding the post of seniors. It should not be only on the basis of experience, it should be on the basis of exam.
True. So if I talk about the feedback from about the seniors basically, I still believe that Indian colleges are not ready to basically take up the new approach of teaching practical knowledge to the students. They are still working on the old age theoretical ये आपकी nerve है ऐसे निकलती है. So what's your opinion on this thing?
See, you have to upgrade yourself. If you're not going to upgrade yourself in very short duration of time, is 4-5 years, you will be obsolete, right? And anybody who is willing to change, that person will grab the market. So if you are not providing the services, yes, someone else will be providing the services, and that student will go to that service provider. So it's my request that you upgrade your teaching, and there should be extra perks, on the basis of ratings. If somebody is, doing wonderful job, the ratings are good, that person should be getting extra. So the problem is fixed payment. Anywhere where the chances of growth are limited, people are not going to do extra work. That's the problem.
So you believe in incentivizing to
Exactly.
motivate.
Yes.
So you have been, if I talk about your teaching career now, so you were a practicing surgeon. Right now I can see you are a full-time faculty. So what made you switch from a surgeon to a faculty?
See, my story was totally different because I told you my life was revolving around, finances. So everybody is having a different story. So when I started teaching, I'm sharing this for the first time. So my seniors started creating problems for me. So they forced me to resign from the institute. So actually I was forced to resign. So I resigned from the institute and then started teaching, on full-fledged basis. So this was journey. Then I decided that, okay, after some time I will be joining some other institute, but it was very difficult because I was having so many batches and there were commitments. So it continued on its own. So it was very difficult for me then to join some other institute when I started full-fledged teaching.
So if I could ask you, what's your history in institutes? What was your trajectory? From which institute you started first, and today you are in which institute?
When I started in Gautam Nagar, there was one institute, AGM.
Okay.
It was FMG institute, 30 students were there. So there was one manager who went to PGDIMS. He recommended my name. At that point of time, it was famous institute for FMGs. So I went to PGDIMS. After that, he went to another institute, PGEI. So I was in PGEI. So when I went there, so I was teaching surgery subject. I got that offer because one faculty just cancelled his class. And he was teaching in some other institute. And you can't believe in the same building, two faculties were teaching. He was teaching and I was also teaching. So first day, no student left the class. So that owner was very happy that it happened for the first time that not a single student left the class. Second, what happened, he told me, sir, 5 to 10 students from that faculty came to our class. And it was 4-day class only. And last day he told that, sir, surgery was the best class of this year. So it's the story of 2012. And after that, in PGI, then I joined PGDIMS, then CCIMS, multiple institutes I taught. So this was the history. And after that, online thing came, and then I joined PrepLadder. So now associated with PrepLadder. Apart from that, at present in FMG, I'm teaching in ARISE, NLC, I'm teaching in Medway, MedNext, NMS Next, Med PG, and some other institutes.
Great, sir. I think that's a great journey. So when you started teaching surgery, I think the time period for surgery was a little bit smaller.
Yes.
Today it has enlarged.
Yes.
So what are the changes that you have seen while you were teaching surgery? How the curriculum and the content has changed?
Right. When I started teaching, I got only 4 days. So what I realized that students are having, missed concept. They're not able to understand some part of anatomy. Then I started, one student suggested me. I was teaching gallbladder and one student came to me. He said that why you didn't tell me the epithelium of gallbladder? Why you didn't tell me the content of gallbladder? So I told him that this is in physiology and anatomy. He said that no, I want to learn from you. He motivated me and then I started working on the feedback of students. They taught us that, sir, we don't know anything. You should have this thing in your mind and then start doing the spoon feeding. So I'm telling you all the faculties, the spoon feeding is the best way of teaching. If you know that the person who is sitting in front of you doesn't know anything, right? Start teaching them. So I started including anatomy, physiology, pathology, radiology also. And that's why it expanded to 6 days. There were certain topics which were common in pathology, medicine, surgery, like thyroid disorders, thyroiditis. So initially it was not included, but student were not having that kind of feeling of completion. So they told me that, sir, please finish it so that we have feeling of completion. So when I started doing that, I started including pathology, physiology, radiology, even some topics of medicine also I started teaching. I could notice that kind of smile students were having, ki mera ho gaya, it's done. So that's why it expanded. And you can't believe, I start class at 9 and it's up to 9. So it's 9 to 9.
So you have been teaching through online medium, through
Yes.
offline medium in a
Yes.
face-to-face class.
Right.
What is the main difference you have found in delivering a class online or offline?
Online is monotonous, frankly speaking, because the student interaction is not there. Suppose students are sitting in my class, so I can, assess their level, what kind of understanding they have. If they are responding to, tricky questions, difficult question, I can understand that, they are learned students, they studied well. But if student is not replying, then I decrease the level. I decrease the speed, reduce the content, explain a bit more. And if student level matches, they are good students, then I increase the speed, reduce the increase the content also. So this is how we do. So best way of offline learning is you can see the feedback on the face of student in front, right? So this is the best way. So you can modulate your speed, modulate the content.
Is the content same for both?
Content is almost same for both, but actually it's a bit high, it's a bit longer in online. Why? Because we used to cover everything. Because in offline we have a limit of 6 days, and students are also having problem of the time. So that's why they are not going to sit there for long. So in online, little bit means we are going to cover 95% of subject in offline and almost 99 to 100% in online.
So how do you think the surgery questions in NEET PG have changed in the last 5 years?
See, when we were, appearing for All India, at that point of time, All India was conducted by AIIMS. So at that point of time, the questions were like this only.
Okay.
But when NEET PG was conducted by this DNB, then they started asking one-liners. Most common symptom, least common symptom, investigation of choice. But for the last 4-5 years, they started including everything. That a 16 years old boy started having pain in right iliac fossa, his TLC count was raised, ultrasound was done, enlarged appendix diameter is this much. Then what is the investigation of choice or best investigation? So nowadays, surgery questions specially, these are integrated. Integration between pathology surgery, anatomy surgery, pathology, radiology surgery. So this kind of integration is there. If you see my opinion, nowadays it's a bit easier. Why? Because if a one-liner question is asked, either you know the answer or you don't know. But if one clinical scenario is being described, you know certain facts and you can easily jump to the conclusion. So longer questions are not difficult ones. Longer question means more information. Image-based question, more information. Slide is there, more information. So this kind of fear that nowadays students are not having. They know that if longer question is there, more information means chances of marking that question increases exponentially.
So between offline and online coaching, if a student wants to join any, which one would you recommend to which type of student?
For FMG, lots of institutes are there. So it's very difficult to, take the name because I teach in most of them.
Yeah, I'm not saying which institute to join.
Okay.
I'm saying which type of coaching to join.
Okay.
For example, if I am a student, let's suppose I come from MAMC itself.
Right.
Now, based upon my ranks, based upon my scores and everything, if I want to join coaching, should I go for an offline? Should I go for an online?
See, online is a must. Why? Because if you're traveling for 2 hours, 3 hours, anywhere, you can watch the videos. So what happens? This time can be utilized. Second thing, if most of the students of your batch are going to join in one institute, it's better join that, right? Because if you're going in the group, yes, you are actually going to enjoy that. Enjoy your, friend circle, and it will be just the fun. You are not able to understand that you are going to, remember lots of things, and actually you are going to enjoy that journey. So it's not about recommendation. Join a PG institute, dedicated PG institute. Second, where most of your batchmates have joined the institute, it's better to go and join that.
Sir, coming back to helping our students for NEET PG counseling.
Right.
Sir, many a times I get a question, how do you basically rate a postgraduate college? What are the key parameters through which they should be rated? Now, so I would ask you the same question. How do we say that this is a good college for surgery, for example?
First of all, see, safety and security. Why? Because if you're not safe and secure, in some peripheral college, if there is no safety security, obviously if there is threat to your life, no need to join that. So first is safety and security. Second, obviously the kind of environment institute is having. If it's a toxic environment, you might take some extreme steps. Don't join that. I'm telling you, you have to come. You came to this world to enjoy life also, right? And this is your first half till 30 years. After that, you have to enjoy your life. So if you're just putting 100% of yourself, you're not enjoying life, then what's the point? So guys, it's not only the branch and the college. Safety, security, toxicity, if the environment is good, doesn't matter. Even if the academics is not that good, you can do on your own. But if patient load is good, these are the parameters. So my suggestion is, yes, go through that department and see the record. The PGs who did post-graduation from that institute, if it's a toxic environment, the surrounding people are not good, safety, security is a big concern, don't join it. So most important, safety, security, toxicity, it should not be there. Even if the medical college is not that good, branch is most important, join it.
So again, putting out, I think the most sought question right now, my favorite branch in a less reputed college or alternative branch in a reputed college, which one should I choose?
Favorite branch in less reputed college.
So reason.
Explain. Let me explain. Suppose I want surgery. Second, I want anatomy. Okay? So anatomy from AIIMS, surgery from some peripheral college. What are the options after doing anatomy from AIIMS? Maximum you can become HOD in that department. You are getting maximum salary of 2.5 lakhs. So anything which is having a cap, yes, obviously the chances of expansion is very less. And surgeon, even if you're doing your surgeries in a nursing home or something like that, people are making more than 10 lakhs, 15 lakhs. So there is no cap. So it's up to your skill, it's up to your growth, which is going to determine your ultimate potential. So don't restrict yourself to a branch which is having a cap. So preferred answer would be your favorite branch in less reputed college.
So which one do you think will be the most upcoming branches in the future, next 10 years?
In next 10 years, obviously it will be intervention. Intervention in minimal invasive format, like intervention radiology, endocrinology, obviously cardiology, nephrology, these branches, and surgery, again minimal access surgery, and oncology and transplant. So these are the upcoming branches. Why? Because if you see the cases, number of malignancy cases increasing exponentially. So the branches in which you are doing anything related to malignancy, like nuclear medicine also, means radiotherapy, interventional radiology, surgical oncology, so these are the upcoming branches.
So can you tell us about nuclear medicine in detail?
See, I'm not having that much idea, but nowadays, see, most of the, suppose it's related to breast malignancy or any other malignancy which is radiosensitive. So after that you have to give the radiotherapy. So nowadays in almost each and every department, what happens, there is another radiotherapy department, and what happens, the number of patients are increasing. That's why till now the number of seats are very lesser. So still in this particular branch there is no saturation. But the cons is that it's available only in the metros. In peripheries, there is no demand. Suppose you want to settle in a small town, after doing nuclear medicine, there is no demand. So it's up to you where you want to settle. If you want to settle in a metro, obviously it's good for you.
And how different is radiotherapy from nuclear medicine?
See, nowadays scans are being done. Suppose HIDA scan is there, scintigraphy is there. So obviously, if malignancy is there, we have to detect SRS is there. So for localization of tumors, we have to go for that. PET scan is there. So that's why these branches are upcoming, and second, these are very costly investigations also. So if you see this average salary, it's quite good in these branches.
So what is the scope of a surgeon outside India? For example, USMLE, MRCP, PLAB, or basically might be Australia. What is the scope there?
Specifically, you're talking about USMLE, there is too much of competition. First, you have to, give your steps. After that, again, you have to do your residency. So again, there is a learning curve, right? The good thing is that after this learning curve, the payment is quite handsome. And second, safety security issue is not there. But obviously job hours are not fixed, right? Second, in PLAB, you must be knowing in PLABs, there are some issues related to races and all. So that would be there, so it's up to you. Australia is a new destination where you can easily settle without doing residency. There is one exam. and I think there is one interview. So these are the good options you can go for.
What about MRCS?
MRCS is just a fellowship degree. So you appear for the exams and you get that degree. That's it.
Is that degree valid in India?
Yes, yes, it's valid. Means it's just an add-on. Suppose you have done post-graduation MS surgery, so it's an add-on.
So now we come to the most favorite question of our audience. All right. So the question is very simple. Sir, how much does a surgeon earn in India? How much does he earn as a fresher, and how much does he earn as an experienced guy after like 15 to 20 years of experience?
Right. As a fresher, if you see the people who are doing attending consultant job or senior residency, so it starts from 2 lakhs approximately in private, if you see. But after doing, super specialty, the beginning amount is 3 to 4 lakhs. And after 10 years of experience, you can't believe per day you can earn more than 1 lakh per day. Because it's based on surgery. Suppose you are doing hernia surgery, minimum 10-15,000. And if you are doing 6-7 surgeries, not only hernia, obviously it's more than 1 lakh. So obviously annual income, if you see, between 5 to 6 CR, if you have good potential, if your skills are good, if you're working in good city, right? 5 to 6 CR. It's an easy thing.
And does the payment increase in second tier or third tier cities?
See, it's up to you. In second and third tier cities, you have to establish yourself there. So it takes 10-15 years. You should be having your own setup. And if you're having your own nursing home or some small hospital, it can increase.
So what's the best thing that you know, best thing you love about being a doctor?
See, the best thing is that we live, asymptomatic life for long duration. Asymptomatic life means suppose I'm having abdominal pain, I know which drug to take. And if I'm non-medico, obviously I will, have that pain for long duration. Second, I can help my family members with the diseases. So doctors are going to live symptom-free life and their family is going to live symptom-free life for long duration. Second biggest advantage, we can detect any disease at early stage in our family members and relatives. So that's the biggest advantage. This is one of the blessings you have. If you have diarrhea, you can immediately take ofloxacin rather than having 5 days of diarrhea. So any symptom you have lots of contacts, everybody is there, some of your senior will be there, immediately you call them, immediately you will get the advice. So symptom-free life.
So what do you think about AI and robotics in surgery in next 10 years?
In India, there won't be too much of role, especially in surgery. But obviously, if you talk about US and China, who are doing really good, there people are doing telerobotics, means person sitting in his own room doing surgery 2,000, 3,000 kilometers away. But it will not be applicable for 10 years in India. Why? Because here, the patient wants to see the face. And nowadays, even in middle class and upper middle class, the patient does his job, homework, that who is this surgeon from here, where he did his MBBS, post-graduation, so all these things. So that human touch patients want. So it's very difficult in any branch in which intervention is required. But in some branches there where only you want to read the investigation, only you want to read the slides, like diagnostic branches, obviously very soon, these things will be taken over, but not everywhere, only in metros, not everywhere.
Well, I believe you are a great investor yourself. You have managed to go from a very humble background to such a great personality. So what would be your financial advice to our young doctors?
Let me tell you guys, academic excellence doesn't lead to financial excellence. If you are going to understand this as early as possible, this will be much better for you. I have seen people, suppose somebody is very good in medicine. That person is good in medicine, but that person is not good in finances. What is the big problem with doctors? I'm telling you, they have very poor financial skill. Why? Because as a doctor, we are the creams of society. So we have this indirect feeling that we know everything. I know everything about my branch, but I don't know everything about finances. So you have to learn. And best way of learning, start reading books. I would recommend some books. These are beautiful, amazing books you should read. Start with Rich Dad, Poor Dad, Secrets of Millionaire's Mind, Millionaire Fast Lane, Psychology of Money. These books are going to change the way you think about money. You have seen lots of people, even you have seen deans, HODs, in which car they are coming to the medical college, Despite of, extreme of the success of their particular branch, they are not having financial knowledge. They are, buying some insurance policies, investing here and there. So if you are earning, you should be investing it properly and without learning. you cannot, do this. So you have to learn by online mode, offline mode, some courses there, lots of online courses are there, you should join. And within, 1 year, 2 year, you will, understand. It's very, very easy task.
So you are an entrepreneur in yourself. You have tried your hands in multiple things, and switching between careers is, again, I always believe, is one of the most riskiest thing possible, because you are switching from something very stable to something very dynamic.
Right.
So what would be your entrepreneurial advice to our young doctors?
See, remember one principle, lesser and better principle. So get the lesser payment and give the better services. Yes, every time you will be having work, and obviously your payment will be increased by the person to whom you are providing the services. So lesser payment for better services, right? So this kind of thing, it is pro business, it is going to promote anybody's business, he will be more than happy. So remember this principle.
So you were a faculty while you were studying. So you had a side hustle. So that shows your entrepreneurial spirit. So what would you recommend as side hustle for our young doctors?
See, one thing is there, anywhere, any point of time, if you find some difficulty in life, yes, if you can ease that difficulty, or if you can provide some kind of solution to that difficulty, that will give you some extra money. I'm giving the example, when I was preparing, so I cleared All India. And after that, I was having 6 months of time for joining the institute. Meanwhile, when I was preparing for Delhi PG, at that point of time, there was one book, Dr. Tek Chandani book. That book was having lots of errors. So I thought that I'm having 6 months, let's revise this book. So I wrote a book for DPG entrance exam. That was my first book. And it was loved by everybody. So what if you have some difficulty somewhere in the life, yes, if you can provide the solution, you will be getting extra income. So that you can do. In the form of, you can help someone in the thesis, you can write some book, you can give some kind of services to somebody. So this you can start. Second, during post-graduation, if you have a chance, means for writing the book, though it's risky also, because if your consultant is going to get to know nowadays, because they are quite egoistic, so that might harm you also. So you can have your project and you can get it published after post-graduation. So anywhere you find difficulty, and if you can provide solution, you should try to do that.
So you are an author yourself. How difficult was it to write a book?
See, when I wrote this book, Delhi PG entrance exam, the royalty was very less, because we used to sell only 1,000 copies and 1,500 copies, and only these much students were appearing for DPG. So the publisher with whom I was associated, there was one guy, manager, he told me that, sir, student, I used to take feedback, they said that this author is very good. And if he's from surgery, why he is not writing the surgery book? So he told me that, sir, you write surgery book also. So that idea came from there, and I started writing. But I didn't get it published during my post-graduation. So just after post-graduation, I wrote this. After that, some of my juniors, they came to me and saying that, sir, we appeared for the AIIMS exam, and the book which is available in the market is not that good. So why don't you write a book for AIIMS also? So I said that, yeah, I don't have questions. So they said that I will be giving you questions. There are two friends. One is Nachiket and one is Saurav. Nachiket is, he is a transplant surgeon now. He did his MCH GI surgery from AIIMS. Now he's in US. And the second guy, he's an orthopedic surgeon. So these were my juniors. So they provided the questions. I wrote the first book. And after that, I wrote the second one. It was 2 papers. And after that, I wrote the whole book. After that, the similar feedback for NEET PG. And then I wrote the book of NEET PG. So I'm telling you, anybody who's going to give you some idea that, sir, I'm having difficulty here. And if you think that you can ease out that difficulty, you can provide the solution, the reward is tremendous.
Great advice, sir. Actually, the entrepreneurship is all about finding a problem, creating a solution, and providing it to public so that they can ease their life.
Yes.
That's the whole concept.
Right.
So, in which year did you sold your maximum books, and what was the number?
When first edition of surgery was launched, the market cap was ours was 20, and there was another book, it was 80. In second edition, it was 40-60, and in third edition, it was 90-10. So,
And what was the number?
Number of books?
Yes.
We sold approximately 28,000 copies.
So that means that like 1.5 lakh students are giving, 28,000 students are actually going through sir's book. So that's a tremendous thing. And so I'll ask you for an advice here also, that if any MBBS or an MD graduate wants to simply, I won't say graduate, I would say a student wants to start teaching, wants to start their career as a faculty, the path.
Yes.
How should they do it?
So if a student is really interested into teaching, first what he has to do, he has to expose himself to the people around. So first you have to sell yourself to the people around. So best way of selling nowadays is you should be having your YouTube channel and you should be putting your videos there. And depending upon the feedback from the students, yes, you can modify it. So slowly, if you're going to increase the exposure, obviously, somebody will be noticing you, I'm telling you. Somebody will definitely notice your skill and somebody is going to give you a chance. Anybody who is going to give you the chance, even for free, just go and join it, right? Because the next chance will be obviously much bigger than the first one.
Grab the chance that you are getting.
Yes.
Sir, for the last question of today's evening, before we move on to the rapid fire, and guys, please do not miss the rapid fire. We have got some very interesting questions. So my last question, I would request you for an advice here for our young doctors, for our NEET PG 2025 aspirants. So what would be the perfect NEET PG strategy? कैसे पढ़ना है, कैसे रिवाइज करना है, एक बार अगर आप फिर से इसको समराइज कर दें, that would be amazing.
See, it depends when you started the preparation. If you started your preparation in third year, so third year, final year subjects, you did it nicely, then your internship should be mainly towards the revision and solving the questions. So if you started final year, so try to finish all the final year subjects because you have fear of failing the exam. Everybody has that. So in final year, I would strictly recommend just focus to final year subjects. In internship, now you revise rest of the subjects, do the rest of the subjects and do the revision. Right? And if you are starting in internship, though it's very hectic, but what then you have to do, because the time is very less, so in that particular time, what you can go for some crisp content which is available. And don't leave the major subjects, especially medicine, surgery, obs and gynae, pediatrics, then PSM, path, pharma, micro. These are the 7 rank deciding subjects. From these subjects only most of the questions will be asked. Rest questions will be integrated. So if you have lesser time, you should go through these subjects. Don't leave any subject. Go for a crisp source or any kind of revision source which is available to you. And most important thing is you have to give the test. GTs are must, because if you're not going to prepare, I have seen lots of students who are very good, but after going to the exam, they are exhausted. And after, when you are exhausted in the exam, your brain stops working and then you started marking answer passively. That B, C, D, E. So practice is most important thing. Practice maximum number of questions. Attend the GT means go for the GTs, and there should be only a single source per subject. Don't go through multiple sources. Go for a single source. So one source, multiple revision. This strategy you should follow.
Thank you so much, sir. I think that was the best piece of advice for all our students. Very concise and very doable strategy. So thank you so much. And now we move to the rapid fire. The boss rapid fire, very simple rules, only 2 rules. First, you have to speak the truth. Second, you have to give us the first answer that pops in your head. Right. No thinking. Sir, we'll start with our question number 1. Sir, favorite vacation spot?
Switzerland.
Which city?
The spots are there. Interlaken is there. So Interlaken is there. Jungfrau is there. And Mount Titlis is there. So actually these are the locations.
It's a beautiful country. I went there this year. Amazing place. So best piece of advice you have ever got?
Books are your best friends.
I think my father says that every time, like every day. 100 crores in bank or 5 sports car?
100 crores in bank.
How much money does Dr. Pritesh require to actually retire in the life today?
In the life today, see, at this point of time, frankly speaking, I'm in the state of financial abundance. So whatever I'm doing, it's just for my fun and passion, right? But my goal is 1,000 crores.
Oh, yes, sir. So what's your goal in life, apart from finances?
Apart from finances, I want to serve the humanity and I want to serve the people around.
Your favorite book?
If it's related to academics, it's Harrison. And if a non-fictional book, then Secrets of Millionaire's Mind.
Best way to relax?
Sitting alone in my studio, doing some introspection, reading books, making some future plans on the paper.
Your favorite dish?
Chawal dal roti sabji.
A secret hobby that we do not know of?
I think people know because I'm formally trained in music. So I represented my state for the singing also. I play tabla, dholak, guitar, sitar, harmonium, mouth organ. I used to play all these instruments. I was trained for 4 years.
Do you still play?
Yeah.
So what's your favorite instrument to play?
Keyboard.
Nice. So your inspiration in life,
Books.
your happiest moment in life,
Happiest moment when my daughter was born.
or what's her name?
Prishika.
So Prishika, your father is an amazing man, a legend himself, and thank you so much, sir, for being a part of our podcast, for enlightening us with so many pearls of wisdom. I believe I can speak on behalf of my audience that we loved every second of it. So thank you so much, sir. And I believe the best part I learned from this is that the books are your best friend. So I think these are legendary words said by every legend, and we are going to follow that. And the books that you have told, guys, please go through those books. I personally would recommend you. Yes, those books are amazing. They would open your eyes to some new horizons. So thank you so much, sir, for being a part of a podcast.
Thank you, Dr. Nachiket, for having me here. Thank you very, very much.
And thank you guys for watching this. If you liked it, if you have any comments, please put it in the comment section. Who do you want? Who should be the guest in the next podcast? Please put that also in the comment section. And if you have liked this thing, please like, share and subscribe. Please subscribe करो, थोड़ा सा follower बढ़ाते हैं, and we can get as amazing guests as Dr. Pritesh here. Thank you so much everyone and all the best. So guys, if you are liking the podcast till now, it's my humble request to each one of you, please do not forget to subscribe. We are looking at some energy from your side to motivate us and the whole team to keep bringing more beautiful guests in our show. So let's make this show a bigger one. Let's invite more doctors who have done some amazing things for our field, and let's celebrate all the beautiful personalities.